What's up, everyone? Today we're tackling a problem that affects so many of us, low back pain. It's one of the most common reasons people visit my office. Why does your back hurt, and what can you do about it? Let's help you become your own back pain detective. We'll break down the most common types of low back pain based on where and how you feel it: sharp, dull, shooting, or aching. By the end, you'll understand the likely causes and, more importantly, get actionable solutions. We'll cover the top 8 culprits and show you exercises and strategies for each, so you can start taking control of your pain today. Remember, if you have severe pain, red flag symptoms, or a recent serious injury, stop and see a doctor. For everyone else, let's get started. First up, facet joint pain. Your spine is a stack of vertebrae, and the facet joints connect them, letting you bend and twist. When these joints get irritated, you'll feel sharp, localized pain, often on one side of your lower back, especially when bending backward or twisting. It's that locked-up feeling, worse after inactivity or in the morning. Bending backward compresses these joints, while bending forward or pulling your knees to your chest can relieve the pain. The solution? Gentle movement and stretching. Try the knee-to-chest stretch. Lie on your back, pull one knee to your chest, hold, then switch sides. The cat-cow stretch is also great. On hands and knees, arch your back up, then drop your belly down, moving slowly. These restore motion and reduce stiffness. Think of it like oiling a rusty hinge. Don't force it. Find a comfortable range of motion. If a movement causes sharp pain, stop. Do these stretches a few times a day. If you don't improve after a couple of weeks, or if pain worsens, see a professional. Physical therapists can help mobilize the joint and suggest advanced exercises. Don't just live with that stuck feeling. Gentle, consistent movement is your best friend. There are effective ways to manage facet joint pain. Next, let's talk about disc protrusion, often called a slipped or bulging disc. Discs are jelly-filled cushions between your vertebrae. When one bulges, it can press on nerves, causing pain that often shoots down your leg. Classic sciatica. You might feel numbness, tingling, or weakness in your leg. Bending forward, coughing, or sitting can make it worse. Many find relief by standing, walking, or lying on their stomach. Try the prone press-up. Lie on your stomach, hands under shoulders. Gently press up, keeping hips down. Hold briefly, then lower. If that's too much, prop up on your elbows. Avoid forward bending, heavy lifting, and long sitting while healing. Gentle walking helps promote healing. If you have pain down both legs, numbness in your saddle area, or lose bladder or bowel control, seek emergency care. This could be cauda equina syndrome. Otherwise, focus on movements that reduce leg symptoms. If pain persists or worsens, see a doctor. Early action can make a big difference. Now, let's look at the sacroiliac, SI joint, where your spine meets your pelvis. SI joint pain is usually a deep ache or sharp pain on one side of your buttock, sometimes radiating down the back of your thigh, but rarely below the knee. It's often triggered by running, climbing stairs, or standing on one leg. Pregnancy can also make this joint more vulnerable. To calm an irritated SI joint, focus on gentle mobilization and stabilization. Try the supine piriformis stretch. Lie on your back, cross your ankle over the opposite knee, and pull the uncrossed leg toward your chest. The glute bridge is also key. Lie on your back, knees bent, feet flat. Lift your hips by squeezing your glutes. These exercises release tight muscles and strengthen stabilizers. Avoid twisting or shearing movements while inflamed. If you're a runner, take a break and focus on stability. If pain is severe or doesn't improve, see a physical therapist for targeted treatment. Balance and stability are the goals. Strong glutes and gentle movement can make a big difference. Let's talk about anterior pelvic tilt, a postural problem, not an injury. Imagine your pelvis as a bowl tipped forward, creating an exaggerated lower back arch. This posture causes a dull, aching soreness, especially with standing or walking. The main cause? Tight hip flexors and lower back, plus weak abs and glutes. Thanks, sitting. The fix: stretch the tight muscles, strengthen the weak ones. For hip flexors, Do the kneeling hip flexor stretch lunge position, back knee down, tuck your tailbone, shift forward. For glutes and abs, do glute bridges and planks. Glute bridge. Lie on your back, knees bent, lift hips by squeezing glutes. Plank. Hold a straight line, engage your core. Practice tucking your tailbone when standing to find a neutral pelvis. Consistency is key. Correcting posture takes time. Stretch, strengthen, and be mindful of your alignment. You can retrain your body and relieve that nagging ache. The gluteus medius, on the side of your hip, stabilizes your pelvis with every step. If it's weak, you'll get a deep ache on the side of your hip or lower back, and your hips may sway when you walk. This gluteal amnesia is common from too much sitting. The fixed targeted strengthening. Start with clamshells. Lie on your side, knees bent, heels together. Lift your top knee without rolling your pelvis. Progress to side-lying leg lifts. Legs straight, lift the top leg slightly behind you. Try monster walks. Stand, resistance band around ankles or knees. Take slow sideways steps. Strong gluteus medius muscles keep your pelvis level and take strain off your back. Don't ignore side hip or low back aches. Wake up those glutes. Consistent strengthening improves stability and reduces pain. If you notice a waddling gait, focus on these exercises. Better glute strength means better movement and less pain. Make glute activation part of your routine. Piriformis Syndrome mimics sciatica, but the pain is deep in the buttock, sometimes radiating down the leg. The piriformis muscle sits near the sciatic nerve. If it's tight or inflamed, it can compress the nerve. Prolonged sitting, running, or climbing stairs can trigger it. First, release the muscle. Do the figure 4 stretch. Lie on your back, cross your ankle over the opposite knee, pull the uncrossed leg toward your chest. Hold for 30-60 seconds, several times a day. But stretching isn't enough. Strengthen the glutes with bridges, clamshells, and monster walks. Weak glutes force the piriformis to overwork, causing pain. Strengthening hip stabilizers lets the piriformis relax. This combo, stretching and strengthening, is the best long-term fix. Consistency keeps piriformis syndrome at bay and relieves sciatic pain. As we age, osteoarthritis and spinal stenosis become common causes of low back pain. Osteoarthritis is the breakdown of cartilage in the spine's facet joints, causing inflammation and pain. Spinal stenosis is narrowing of the spinal canal, putting pressure on nerves. Classic symptom: pain, numbness or weakness in the back, buttocks or legs that worsens with standing or walking, but improves with sitting or bending forward. The shopping cart sign, leaning forward for relief, is typical. We can't reverse these changes, but we can manage symptoms. Focus on flexion-based movements. Lying on your back, pull both knees to your chest. Cat-cow stretch gently mobilizes the spine. Stationary biking is often well tolerated. Gentle core strengthening like pelvic tilts and modified planks helps stabilize the spine. Balance mobility and stability to stay active and pain-free. Movement is key to managing these conditions. Scoliosis is a sideways curve of the spine, sometimes painless, but it can cause muscle imbalances and joint strain. Pain is usually muscular, tight, shortened muscles on the concave side, weak, overstretched muscles on the convex side. The location of pain depends on where the curve is. Management is about restoring balance. Stretch the tight side, strengthen the weak side. Try side bending stretches away from the tight side. Physical therapists can prescribe specific exercises, like those from the Schroth method, tailored to your curve. Most adult back pain isn't caused by scoliosis, but if you have a significant curve and pain, see a specialist. For most, focus on core strength, flexibility, and posture. Individualized exercise is key for scoliosis-related pain. Stay active and address imbalances for best results. Good posture and strong muscles help manage pain. We've covered a lot. Now you have a clearer picture of what might be causing your low back pain. Check the video description for links to more detailed routines for each condition. If your pain is severe, constant, or lasts more than 6 weeks, or if you have red flag symptoms, see your doctor. For new, mild pain, try the exercises we discussed. Start slow, be consistent, and listen to your body. You have the power to take an active role in your recovery. Thanks for watching, stay healthy, and I'll see you in the next video. Take care of your back. It's the only one you've got.